This slide series is done in memory of Dr. Edward Ross Ritvo, who passed away in June of 2020 at the age of 90 years. A pioneer in autism research, he led the field in establishing that autism was neurobiologically based. A graduate of Harvard and a U.S. Army veteran, he spent his entire academic professional career at UCLA. His work included studies of diagnosis and classification, genetics and epidemiology, as well as neurobiology and psychopharmacology. He trained generations of leaders in the field and is survived by family members and many, many students. It's an honor to dedicate this series of talks to his memory with the support of Dr. Ariella Riva Ritvo Slifka and the Alan B. Slifka Foundation.
Welcome to the Center of Excellence on Autism Spectrum Disorders at Southern Connecticut State University's Professional Educator Training Series. This video is an introduction to challenging behavior, and my name is Dr. Meghan Brahm. I am a board-certified behavior analyst, an assistant professor at Southern, and a center team member. The objectives for today are to understand the definition of challenging behavior specifically, understand why challenging behavior occurs and continues to occur, and to start understanding the very basic pieces or processes of a functional behavior assessment, or an FBA. Some terminology for the presentation to start is behavior. So when we talk about behavior, we simply mean everything and anything we say or do. So we could mean talking, blinking, drinking, walking, thinking, etc. But when we talk about challenging behavior specifically, we're talking about behavior that is A, harmful to a person or to other people, so harmful to the individual engaging in the behavior or others around them. B, prevents access to learning or access to participation in the community. Or C, leads to some sort of isolation. So it's important to differentiate behavior and challenging behavior as they are different things. Functional Behavior Assessment, or FBA, this is a method for identifying the underlying causes of behavior and being able to change behavior by understanding their causes. A behavior intervention plan, or a BIP, commonly referred to. This is a comprehensive plan that is specifically based on the results of the FBA, which details all of the steps and supports that are going to be implemented to support an individual in changing their behavior, and it details how the supports will be used and how they will be feeded. Understanding challenging behavior is one of the most important considerations or most useful things that one can learn when supporting an individual with autism spectrum disorder. It's important to know that behavior can occur at any point in a person's life, and it can occur for varying reasons. So the same behavior can occur at a different point in someone's life for different reasons. Really crucial to the consideration of challenging behavior and to the individual with autism themselves is the person is not behaving, quote, badly or being bad. Rather, their engagement in challenging behavior is simply them trying to get some sort of need met. And it is our responsibility as the interventionists or as the people supporting these individuals to remember that behavior is communicative, and it is our job to understand what that person is trying to say and support them or help them in getting their needs met in a more adaptive or more functional way. Decreasing challenging behavior is a very common goal for individuals with autism spectrum in school, which means that challenging behavior or the presence of challenging behavior is often a consideration for individuals with autism in school. But it is critical to know and understand that autism spectrum disorder does not cause challenging behavior. Rather, some of the core symptoms that are associated with autism may lead to an increase in challenges or an increase in challenging behavior. So let's think about the example of a person who may have limited verbal ability and may have some auditory sensitivity. So let's say that they're in an environment in which they are accessing quite loud sounds. And so that individual may not be able to say that I need a break from these sounds, or the sound is too much for me right now, or I need to walk out. But rather what you might see is elopement behavior, or them running out of the classroom to get away from the noise. So we need to remember that individual is not, like we said, quote, being bad or quote, behaving badly. Rather, they are simply trying to get a need met that they may not have the ability to get across to us as the adults, that need is there. So we need to be able to understand what they are trying to say, and again, give them a way to say it differently. One of the things to consider also about challenging behavior is learning history is really important. So we need to remember that individuals don't come into our classrooms or into our schools in a vacuum. Instead, they come in with a whole history of learning that has existed for the entire time they've been alive. So somebody who has difficulty in math class may engage in what we call desk clearing behavior, or moving all of the materials off their desk, typically throwing them to the floor. In the past, that may have gotten them away from a math task that they didn't want to do. So when they get to our classroom, they're more likely to engage in that desk clearing behavior again, because it got them what they needed at that moment previously. So again, it's important to remember that what has happened in a person's past and has been successful in getting their need met in the past is likely to happen again. Relevance to autism in school, again, is that often challenging behavior is managed quite easily, or sometimes easily, when a person is young. However, we need to consider that challenging behavior becomes increasingly problematic as an individual gets older. So individuals get taller and heavier and stronger, and those individuals who may have been 3 or 4 when they came into school and their challenging behavior was quite easy to manage becomes really problematic when they might be 19 or 20 or 21 years old and still have not gotten that need met, and their challenging behavior is still occurring. It might be more dangerous to themselves or others. And really importantly there, the consideration is we do not want an individual to have a necessity to engage in challenging behavior for any period of time, let alone throughout the entirety of their school career. So we really need to make sure that we are implementing interventions that support that individual at the moment they need it, and that those implementation of interventions are successful for that individual. Challenging behavior can lead to personal frustration, time out of class, which means academic or learning loss, social isolation, and of course, safety risks. Those are all things that are really important to make sure that we decrease. So understanding behavior itself is important to understanding challenging behavior. There are some behaviors that happen because of our biology. There's some things that we are born innately with, things like reflexes, for example. But most behavior that an individual engages in happens because it serves a purpose, or it has been learned, or what we say, it has a function. So the function or the purpose of behavior is critical in understanding why they are behaving a certain way. And we need to understand that function before we can understand how to help. So we need to do this through a functional behavior assessment or through an FBA. And an FBA needs to be conducted before we can implement an intervention, because we need to understand how to help. And we can't understand how to help without the appropriate data. Otherwise, we run the risk of making some pretty significant errors, which ultimately only harm the individual we are trying to support. So as we said, a functional behavior assessment is a method for identifying the underlying causes of behavior. It is a comprehensive assessment, and it's grounded in the understanding that behavior continues because it is reinforced in some way. So there is some outcome when a behavior occurs that is maintaining that behavior. Otherwise, it would not still be occurring. The outcomes, importantly, especially in schools, the outcomes of behavior may appear undesirable, or they may seem like there's something that somebody wouldn't enjoy from our perspective as the teachers or the interventionists. But it's critically important to remember that we don't make that determination. We don't make the determination on what is preferred or enjoyable or unenjoyable or undesirable. It's the individual that makes that decision for themselves, and their behavior tells us that. So behavior is continuing because it's serving some particular function or some purpose, and that behavior is being reinforced, which leads to its continuation of serving a function. One of the things that I do want to say as a prelude to functional behavior assessments is, first, we must consider biological or medical concerns or causes. So for an individual who may have limited verbal ability, they may, let's say, have some gastrointestinal issues. It's actually quite common for individuals on the autism spectrum to have gastrointestinal issues, and somebody with limited verbal output may not be able to say that my stomach hurts right now. So instead, what we may see is an engagement in challenging behavior. Well, that may be something that is in the realm of medical concern and needs to be dealt with very differently. So we need to think about and rule out medical or biological causes of behavior before we are doing any sort of assessment or implementation of an intervention. So the first process, or the first step in the process of an FBA, is identifying and defining the behavior of concern. And so the reason that we put so much emphasis on defining the behavior of concern is because behavior can be defined by different people in different ways. And so what I may view as an instance of a particular behavior, someone else may not. And therefore, our data collection and ultimately our intervention may not be accurate. So we really need to ensure that we have what's called operational definition of behavior. And that means that we are defining out an instance of behavior in its observable components, not just putting a label on behavior. So as an example, let's say we're defining hitting. An operational definition of hitting may sound something like any instance where Meghan brings a closed fist in contact with one of her body parts or the body part of somebody near her with enough force to leave a red mark. Just as an example. That's not a perfect operational definition, but just something to think about. So identifying and defining the behavior of concern are a really important first step to an FBA so that we can then successfully move through the rest of the FBA process and creating an intervention. The second step is we need to gather information. So that's data collection. There's two different ways in which we gather data with regard to an FBA. The first would be what we call indirect methods. So indirect methods refer to data collection procedures in which we are not directly observing the instances of behavior, but rather they're retrospective in their analysis of behavior. So these may be interviews or rating scales or some sort of record review to get a better understanding of the individual and their behavior. Oftentimes, the individuals who are interviewed or completing rating scales or checklists are members of the school team. But what I want to stress here for a moment is that families must be involved in this process. It is very, very important that families are involved in any and all educational processes for their children. But in particular, with an FBA process, it is very important to include families because we need to make sure that we are getting a full picture of the behavior and that we are understanding what types of interventions will support the behavior and the consideration that an individual spends a good bit of their time at school and a good bit of their time at home. Behavior doesn't happen in a vacuum. So behavior that is happening at school may also be happening at home, and having the congruency between home and school is very, very important in terms of predicting success. So we must include families in the FBA and BIP process. The next way by which we collect data is called direct data collection methods. So these are methods where we are actually seeing the behavior occurring and we are collecting data in vivo or at the moment of behavior occurrence. For an FBA, this is what we call ABC data collection. This is the most important component of an FBA, and in fact, an assessment process cannot be considered an FBA unless there is direct data collection. Indirect data is never enough for an FBA. So we're going to talk in depth more about what the ABC data collection means. But if we look to the right of the slide here, what we see is an ABC data chart. And I'm sure some of you watching will be familiar with these data collection sheets, and you might even have implemented data collection procedures on some of these. But what we're looking for is the collection of data on the antecedents, the behavior, and the consequences so we can understand what exactly is eliciting and maintaining behavior. So we're going to talk about what antecedents and consequences mean in just a second. Lastly, in an FBA, we need to review and assess the data so that we can create what's called a hypothesis statement. A hypothesis statement allows us to take all of that really rich information that we have gathered, assess it really well, and put a statement together that says, per the data, or it is likely based on the data, that this challenging behavior is maintained or reinforced by these things. It is called a hypothesis statement because we can't say for sure that behavior is maintained by any particular thing. Rather, we have a very, very, very good idea based on all of this data that behavior is maintained by a specific function or a specific outcome. So as promised, we are going to talk more about those antecedents, the behaviors, and the consequences. And so when we're analyzing these things, we are thinking about what we call the WHs of behavior, or in other words, when behavior happens, what the behavior is, and why it continues to occur. So the antecedent column talks about when behavior occurs. So antecedents directly look at or assess the events or the stimuli that are in the environment or happening in the environment directly before an instance of behavior. The behavior is the event itself, the thing that we've created the operational definition for. And the consequence is what follows the instance of behavior. So, as we said, antecedent stimuli are present in the environment before behavior or preceding behavior. So they can be almost anything. They could be a verbal demand, they can be particular people in the environment, they can be certain assignments, they can be almost anything. The antecedent stimuli are relevant because they are what essentially tells a person to behave. So when I'm sitting at my desk and the teacher puts down a reading assignment in front of me, I know from that reading assignment, it is time for me to engage in desk clearing behavior so that I can get out of doing this assignment, as an example. Importantly, antecedent information gives us really good data on how we can prevent instances of challenging behavior from ever happening at all, and allows us to understand the opportunity where we can teach replacement behavior or teach new behavior. And remember, the ultimate goal here is to be able to teach people or individuals with autism spectrum disorder to get their needs met in a more functional way. So when we understand antecedents, we can understand where we can teach that replacement behavior or teach them to get their needs met in a different way. So antecedents are huge in the concept of proactivity. And so we always want to be proactive. We want to be preventing as many instances of challenging behavior as we can, and we want to be proactive in teaching something different in its place. Consequences, again, are the events that occur after behavior. So this tells us how the behavior is being reinforced, and ultimately it tells us what the function of behavior is. We're going to talk about functions of behavior in just a moment. But when we understand consequences, we understand what's reinforcing behavior. Then we can remove that particular reinforcer, and we can start to understand how to change the behavior. If you're looking for more information on reinforcement, please see the Reinforcement Essential video within this video training series. So the 4 functions of behavior. Again, we understand that we have 2 different sets of behavior, if you will, things that we are biologically equipped with, we are born with, things like reflexes, and then we have basically everything else in our behavioral repertoire. And we know that everything else in our behavioral repertoire is maintained or occurs or has a purpose, which is one of these 4 functions, which is attention, escape or avoidance, access to tangibles, and a sensory function. So it is critical in our steps to this FBA then BIP process that we determine the function of behavior before creating an intervention. Because if we create an intervention that is based on the wrong function of behavior, so meaning we assume that behavior serves one purpose when it actually serves another, we run the risk of actually making behavior worse over time. And that is never our goal. So the function of behavior, or understanding the purpose of behavior, is what the FBA gives us. So understanding the consequences directly translates to understanding the function of behavior. Attention is the first function we are going to talk about. One of the important things to remember about attention is that it can either be positive or negative. So it can be what looks like good attention or what looks like bad attention. And funny enough, people can work or enjoy or prefer both. So there are individuals who may really find negative attention to be reinforcing or to be a preference. And so all of the corrective feedback that we give individuals who may like or prefer negative attention could actually be making behavior worse. So we really need to understand what type of attention we're talking about when it comes to what we call attention-maintained behavior. But the attention function basically states that individuals have a desire for attention, or that they like attention, and therefore their behavior continues to persist over time because their behavior is getting attention from someone. So oftentimes the attention-maintained behavior can be in the form of attention from peers or from adults. Behavior which is attention-maintained usually occurs when specific people or specific individuals are present. And it may happen all the time in a school setting if the desire is for attention from peers, because generally speaking, peers are present almost all the time in school settings. So attention-maintained behavior tends to be person-specific. It's not so much about an event or a specific location, but rather about a specific person or people. And here, we can also see attention-maintained behavior in the form of what seems like a power or control struggle, or behavior that is looks like it's meant to obtain power or control. The next function we are going to talk about is escape or avoidant maintained behavior. So first, let's differentiate the two terms. Escape maintained behavior means that it's behavior that gets us out of something, whereas avoidant maintained behavior is behavior that prevents something from ever happening to begin with. So let's take the example of an individual walking into the cafeteria. An individual who has escape maintained behavior, what you would see is that they get into the cafeteria, they are in the cafeteria for a given amount of time, and then they leave the cafeteria or they escape the cafeteria. Whereas an individual who would have avoidant maintained behavior would not go into the cafeteria at all. They, let's say, may turn around and run down the hallway, or they may sit on the floor and protest going in. So it would prevent them from ever accessing the cafeteria to begin with. So it's an important distinction because understanding the difference between escape and avoid allows us to put in an intervention at the correct time. So let's keep that example. If we have an individual who is escaping the cafeteria, it means that we can set them up to be successful by understanding how long they're staying in the cafeteria for and allowing them to leave, or teaching them to ask to leave the cafeteria before they're expelling all of their time which they can stay in there or they want to stay in there. So we can teach them to ask to leave before they would typically run out of the cafeteria or elope the cafeteria. Then an intervention for a person who may have avoidant maintained behavior in going into the cafeteria, we may, as an example, use something like a systematic desensitization protocol where we take little approaches towards the cafeteria bit by bit until they're in the cafeteria, but also that we're decreasing whatever the reason is they don't want to be in the cafeteria. So let's say that maybe the cafeteria is too loud. We would also support them in ensuring that they have some mechanism to decrease the loudness or the stimuli from the cafeteria, maybe like noise dampening headphones. So understanding the difference between those two things are really important in terms of creating the appropriate intervention and the timing of the intervention. So where you start intervening. Behavior that is maintained by escape or avoidance most often occurs in response to a specific person, a specific event, or a request to perform a specific activity. So escape or avoidant maintained behavior isn't likely to occur throughout the entirety of the day. It's in relation to a specific thing. And the outcome ultimately is getting away from or out of something that you don't want to do or don't want to be a part of or a place you don't want to be. Next, we have access to tangible items or access for a specific item or activity. So behavior that is maintained by access to a tangible item is often occurring most often when an item or an activity has either been denied to the person or has been taken away. One common event or a common example of this that I see in my work with individuals with autism spectrum disorder is a school team may say that they don't provide an iPad during the day or they limit access to an iPad because a student or an individual has a very difficult time giving it back or turning it back in when the time to end the iPad occurs. Oftentimes, this takes a very structured and a very systematic approach to an intervention. And so we really want to understand that access to a tangible item or activity is not a person-centered or a person-specific and not necessarily an event-specific behavior. Rather, it occurs with direct relation to a specific thing or the denial of a specific thing. Lastly, we have sensory maintained behavior. So what we know about sensory maintained behavior is that it meets a particular sensory need. So whether it be decreasing or increasing sensory input or access to such, we understand that sensory maintained behavior can occur at any time, anywhere throughout the day, and often occurs in multiple areas or at multiple times of the day. We say it's indiscriminate, so it happens across most of the day. Sensory maintained behavior is not person, event, or location specific, but rather most often, not all the time, but most often it occurs in a variety of locations surrounding a variety of events or a variety of people. So one of the things that we know is relatively commonly seen in individuals with autism spectrum disorder are self-stimulatory behaviors. So those are behaviors that are likely to be sensory maintained, and they serve some sort of sensory need for an individual. And there's a lot of discussion surrounding interventions for sensory maintained behavior because here's the thing, is it is not ethical for us to remove or decrease or take away sensory maintained behavior for an individual because that individual has the right to that behavior. It's not okay for us to take their rights away, ever, anybody's rights away. And so the way we need to approach sensory maintained behavior, most often, again, not all the time, but often, is to teach an individual when it's okay to engage in certain sensory maintained behavior and when it's not to try and remove the behavior altogether. So that's really something to consider when we're thinking about the ethics of interventions. Now, as we talked about, we're going to mention a behavior intervention plan. So this is why we conduct an FBA. The whole purpose of an FBA is to gain information that allows us to then go and create a comprehensive plan which understands behavior exactly, understand what elicits behavior or evokes behavior or triggers behavior, if you will, and then ultimately what reinforces the behavior, which is the function of the behavior. We then can learn what behavior needs to be taught in its place, or what we say is the appropriate functional replacement behavior, and we can help that individual to get their needs met in a better way, which is, of course, the whole outcome or the whole goal. So when we're thinking about behavior intervention plans, there's two things to really keep in mind when we're creating the interventions or when we're selecting interventions. The first thing that we need to consider is the person's strengths. So this is not something that is challenge-focused or deficit-focused, is sometimes referred to as. Rather, this is a strength-focused plan. So what does this person do really well? What are their strengths? And how can we utilize those strengths effectively to make this person have a more predicted, successful outcome? How can we help their strengths? How can we utilize those strengths? The other consideration of a behavior intervention plan is they should always come from a person-centered approach. This is not about the behavior. It's not about the disorder. It is about the person. How can we help this person live a more fulfilling life where their engagement in challenging behavior is decreased? because challenging behavior oftentimes can be exhausting. It can be frustrating. The reason that an individual is engaging in challenging behavior has got to be frustrating. And so our job is to help them live a more fulfilling life where their needs are being met and their strengths are being utilized, not what we think should be done, but what's best for that person. And really importantly here, what that person is telling us. So individuals can offer us a ton of information if we just listen. So we need to sit back and find ways to get an understanding of what that person wants or what that person needs. And there are many, many, many ways we can do this. Even with the youngest individuals and the individuals who may have very low verbal abilities, we can still find their wants and needs and preferences. We need to just take the time to do that before we implement a behavior intervention plan. We also, really importantly again, need to be considering the family. We need to make sure that we are having family input to all components of behavior intervention plans, and we are ensuring that behavior intervention plans are going to be successful in both the school and the home environment. So, as an overarching wrap up, we need to remember every person has the right to live a happy, safe, and healthy life, and where they have choice. So we need to ensure that we are embedding choice and we are giving the individuals a voice within their intervention plans. We need to remember that challenging behavior is one of the most significant barriers to living a healthy, happy, safe life that is full of choice. And we have to help our best, but we can only do that if we listen. To learn more on some of the topics that have been mentioned today, please see Presentation 2 in this video series, which is an introduction to learning, Presentation 3, which is reinforcement essentials, Presentation 8, which is prompting. Thank you so much for listening. For more information on our center, please visit our website, and to contribute or support the center, please see the bit.ly link below. Here are additional resources should you choose to read more on the topic.